Hey everyone, Dear Murdoch here from Adonis. I lead the marketing team here, and I'm so excited to be kicking off another exciting episode of the Revenue Innovation Series. Joining me today is Ruby, VP of Revenue Cycle Management and Allied Digestive Health. Ruby, thank you so much for joining us. I'd love for us to start this conversation by learning a little bit more about you, about Allied Digestive, and if you can even give us a quick insight into your career to this point, that would be amazing.
Sure, sure. Hi, everybody. My name is Ruby Ramos, and I have been doing this since I was 15 years old. Um, and no, it wasn't that I was inspired by RCM since I was 15 years old, but actually, I asked my mom for a new bike, a pink mongoose to be exact. Summertime was coming. And at the time, my mom was a COO for a private equity owned multi specialty surgical group. And she asked, Sure, would you like to come make some money by assisting us with sending patient bills? Or at that time, I'm telling my age, stuffing envelopes during the summer. So I received my working papers, and that was the beginning of my journey. Um, my first position was with a large multi-specialty group. Since then, have sold multiple times over, but I started off with Summit Medical Group, and they've, you know, got purchased multiple times after that, and they grew by leaps and bounds. I worked my way from patient services and then joined their RCM acquisition team. And I just didn't stop there. After that, I went to work for St. Barnabas Medical Center, became a manager of patient access, and I still wanted to grow. And I obtained my MBA and journeyed through more PE owned large multi specialty groups. And now I am at ADH. Allied Digestive Health is a multi specialty GI group across New York and New Jersey. I oversee the cash, or in other words, end to end RCM and coding compliance for the entire organization. And to be honest, all of these journeys have caused me to visit my hairstylist more often than not to cover my grays because these payers drive me crazy.
I don't think you're alone there, Ruby. It is a common theme and shared challenge, trauma, some might call it.
Yes.
But it's sort of like a rite of passage to a degree. Ruby, I'm really curious, like, of all the experiences you've had, they seem extremely diverse and challenging across the board, especially when you're thinking about multi-specialties. You're not just thinking about in the context of one type of care. It's
Right.
multiple forms, and they all have different needs and nuances, particularly within RCM on every single phase. What was the most formative, right, out of all those experiences? I'm curious. Is it some of the work you're doing now? Was it work maybe in previous experience? I'm curious to learn what was, the thing that really cemented your perspective on RCM.
When I worked with the hospital and I grew within the hospital before I went to PE. We had a $1 billion accounts receivable. And um, that's what really drove me to want to be better and help. I saw all the challenges that was, happening and how payers weren't paying. And then watching my mom also with the same struggle being, especially private equity owned, the pressure's on. And she shared the same experiences, which she has been a mentor for me through these challenges. And oftentimes we went to get our hair done together. So she just retired actually this year. So
Oh, congratulations there. That's amazing.
yes,
But
yes,
yes, it stayed closer than the family, and I'm sure you learned a lot from her. And
yes,
I'm sure things, and of course, things have changed, right? I think
yes,
this is a space that is as nimble and as ever changing as any other in comparison, and becomes very challenging to keep up with. I think a lot
yes,
of that theme will play out in much of the rest of our conversation as we talk about
yes.
the challenges associated with detecting and actioning underpayments, denial prevention, alerting, like all of that. But I'll before we jump into that, I'll share that we executed some research over the last 6 to 9 months to better understand, what are the things that are keeping folks like you, Ruby, up at night? What aside from, of course, the shared trauma around payers, of course, all sort of roads lead there. But our research found that 61% of respondents said that denial and underpayment management is their RCM challenge in 2024. And I'd love to unpack that as much as you're, of course, willing. And I'm all but certain that you have a tremendous amount of experience here based on all the time that we've gotten to know each other over these last few months. But let's talk about that. Underpayments are such a tricky problem to solve because in many cases you don't know what you don't know,
Mm-hmm.
right? And meaning you really don't know where you're getting underpaid, the amount that you're missing out on per claim, and how much that ends up summing up to each and every year or particular time period. Talk to me a little bit about those dynamics, right? And why does it play out the way that it does, and particularly at a multi-specialty group such as yours?
Sure, thank you. So I've got to be honest. Um, Data, right? It's either not enough data or the data that isn't actionable, right? So it's a combination of the data that I'm pulling is not giving me enough, or the data that I have isn't really accurate or actionable, or it lacks like the sharing knowledge, right? To be actionable. It's like, okay, we're seeing Blue Cross and Blue Shield, we're seeing a dip in payments, but we don't know what CPT level, why, um, is it payer policy, things like that. Another thing that really has impacted these types of issues are the fee schedules, right? A lot of contracts have many plans. For once, we have 12 plans with Blue Cross. And oftentimes, sometimes you have these negotiated rates where they increase over time. Payers will keep paying you the same allowed amount, right? And if you're not managing that or managing your underpayments, that can also be missed, right? And it can stem from the fee schedule, the contracted fee schedules not being updated. And that alone is completely impossible to manage by a human being, right? There needs to be something else that helps to capture that data. And oftentimes, you know, organizations weren't really investing in revenue intelligence or anything of that nature. They were solely relying on finance departments with spreadsheets and people. But there's this gap that people don't see. Pairs are designed to deny. That's what they do. They create these teams to figure out what can we find not to pay the claim. I'll give you an example. One of my employees just left. She managed our AI intelligence platform and for coding, and she went to a payer who created a platform, an AI platform to capture things that are missing so they can deny the claim. That's her job. So she went to the other side. And
That's the dark
unfortunately,
side, if you will.
yeah, she's on the dark side. And underpayments, they cause huge cash flow issues, right? And oftentimes the EOBs on the allowed amounts are also inaccurate. So it can be misleading and you can miss that because oftentimes ERAs are posted by automation. So if the automated system doesn't capture the allowed amount as different than the total paid, then now you also have an underpayment. And because a lot of people are utilizing ERAs, that's often missed. So that this can impact on so many levels, right? And then you're trying to catch up, especially with a large group like this. You're like, okay, it's coming from here, it's coming from here, it's coming from here. You really don't know. It becomes a puzzle and you're trying to piece things together.
You're basically
But
trying to do forensic accounting,
right,
if you will.
exactly, exactly. And I think by having a an accurate fee schedule in combination with a revenue intelligence platform that will capture those types of issues that will almost be missed. Every position that I've had, I was hired to basically find money. And every time I found money was in these areas. And now we obviously, we work with you guys, and this is exactly what you have helped us capture that almost everybody's missing. And people don't really see the value of revenue intelligence until the return on investment happens with something so small like this, where you think, oh, the ERAs, they're posted, there's no difference in payments, right, from the allowed amounts, but oftentimes the allowed amounts are incorrect. And I can tell you that I've seen that for the last 2.5 years I've been at my current organization and prior. So you, Adonis, have really helped us, tackle that to a point where it's so simple compared to how we had to do it before. So, so that's where, revenue intelligence really helps any organization, even the smallest organizations. The smallest investments will pay for themselves if it's being managed appropriately.
Exactly. And Ruby, we're so proud to be partnered with you guys, particularly on this very like important and somewhat obvious but deeply complex problem, right? And I think you put it extremely well when you say the answers to your problems exist within the zeros and ones of your data, but can you interpret and action that data in a thoughtful and efficient and effective fashion?
Right.
Day after day after day, payer by payer by payer, and then all the other layers, right, that you were just speaking to. Can you go into a little bit more detail as to how the intelligence piece really comes to, what it looks like in the day of a life for you and your team?
So now I can put it, I mean, it's sounds very simple and difficult to believe, but it's the truth. So now we have, instead of us running multiple, doing VLOOKUPs on spreadsheets and pulling the payers and then kind of comparing manually, like importing the fees, now we just have a click of a button. We have it as part of our daily dash where we're able to go into underpayments. We can filter whatever timeline we want to see. So let's just say we're up to September 30th, right? Now we're just going and we're updating to October 30th. We're able to extrapolate that data very quickly with, Adonis has a lot of exportable reports, which are great, which then goes right to the payers. See, payers, when it's large amounts of underpayments, they like something called projects. And people who are in RCM knows the painfulness of doing these projects. It's automatically done with Adonis, where to show all the gaps by CPT level, by location. You can manipulate it any way you want to, send it over to your provider rep, and then, hoping the intentions are that they're going to pay a bulk payment. Oftentimes they don't. Lately, they've been paying, you know, claim by claim within another EOB with other claims. But it's also helping us keep our payers accountable, right? Because we have a contract, we trust, with this signature, we both agree that this is what you're going to pay us. So keeping them accountable is also important. And oftentimes, sometimes payers don't update different sections in their systems. The EFT, right, or where you do the clearinghouse may be updated, but then on the payer side, when they process the claim, it's not updated. You call the rep, they're like, no, you're not par until 10/1, but we were par since July 1. So those kinds of things where there's disconnects in every single area on the payer level as well. So being able to just click a button and track this also helps as well keep the payers on task. And that's, important too, because now you don't have to manage so many separate spreadsheets. You already know based on a click of a button with how we have it set up with Adonis, where you're able to see this, all of this is with the payer. And once they get paid, right? Obviously, when you click the button, it'll update and it'll show the difference between which ones were paid and which ones were not, corrected. So that also helps because that was also a pain point. Now going back to the spreadsheets to validate and do VLOOKUPs and see, okay, if we have $1 million project of $1 million actual payments due, we have to now take this spreadsheet and go through each one and make sure they tie together. So it's a
Well,
lot easier when you're utilizing intelligence.
the level of specificity is astounding, right? Ruby, like
Yeah,
it
yeah.
truly is. And I'll ask you another question that just sort of got inspired as you were going through all that. What does it mean to the teams? Like to be having a tool like that at their disposal, and it feels in the way that you're describing it a pretty transformative night and day sort of difference as it relates to how they attack underpayments from a position of strength now.
We're able to get them a lot faster. I think we were trending at, 3 months to by the time we were just catching up with the first couple of projects. Now we're able to at least, we hope, like, so for example, we had a special project where we sent to one payer and we sent it in September. They're already responding. We're constantly sending them the same sheet. Hey, this is what we're seeing. We're saying that you're paying it claim by claim. We keep sending updates to say we haven't seen anything. So it's just sending an updated sheet, going back to the payer. It's so simple compared to having to go claim by claim by claim within the system. So because you guys have our contracted rates, we're able to see, okay, these claims are still open. Just clicking of a button, putting a date range in. So that's how simplified it is. And it allows them to be more effective and efficient and not waste time, right? So that's also another thing. And also helps you streamline your staff to be more efficient. That also, it helps a lot, to be honest with you. That has increased a lot of efficiency.
It's incredible. And I try to synthesize it into like, we're here to empower teams and put
Yep.
you back on the operational front foot of these scenarios, right? Like before, it may have felt like it was more of a lot of catch up or sort of backpedaling or not feeling like you're in an advantageous position, right? To
Right.
abdicate, to collect for the financial amount that you're deserving of. And
Yeah.
so anyway, it's exceptional to see the work that you're doing, Ruby, and thank you for being such an amazing partner to
Thank
us in
you.
that
Thank you.
capacity. Let's transition next into denials, right? I think that gets the the
Yeah.
two-headed monster, right, of underpayments and denials and how you guys are thinking about denial prevention, being such a pervasive challenge and why it's more important now than ever to be ahead of denials. What is it that means to you, like particularly as it relates to collecting the revenue that you and your team deserve?
All right. So denials, the bane of my existence. Well, one Christmas, my team had a shirt that said, it said designed to deny, we're designed to deny, meaning we're going to deny their denials. Um, um, basically, um, right now, we have your alerts, right? And what we didn't have, and I start with that because prior to that, we had to run reports constantly every single week. And then we started doing it multiple times per week because as if you're in a growing company, people who are watching this who are, you know, either private equity owned or just acquiring many groups, 12 or 15 groups in a year, things like that. The denials capture, right? And prevention is very important. Oftentimes you're adopting bad behaviors of which, if you have a good trending denial rate, all of a sudden something comes in and you're like 20%. What? Oh, 15%. What? What happened? Wait, what happened to my metrics? So being able to capture all those things ahead of time and trend it. And I go back to the word data, right? Because data is also king for denials. Understanding the denial types and where they're coming from is really important, right? And oftentimes people just say, "Oh, the claim got denied. I don't know why. I need to look into it." But looking at the data trends and then trending and seeing, okay, here's your top 5 denials by your payers, and here's why. Those are the things like the key for me being an SVP for ADH right now. That's the first thing I look at is how do I answer my 5 whys? Oftentimes that was a lot harder to do, right? You have to run one report, then you have to understand where the other report comes from. Your system doesn't print or pull the CARC and WARC codes. They actually pull their version of a denial, which oftentimes isn't accurate either. And based on the claims, sometimes the payer, their denial wasn't accurate either. So between all three, it's like, okay, let's just figure out and assume based on what we're seeing and trending, which we did work with Adonis, right? So we knew specific codes, let's say it's 15, and 5 of them were being categorized as something totally different. You have a team that's not so experienced working on something that should go to an escalated, denial group. So we were able to then also capture, you might see 10 or 15 of this, but this actually really means this. So we were able to convert, right, together with the donors what these denials really mean and where they should go. So instead of going to the wrong people and possibly working it incorrectly to get it denied again, it's now going to the right people so it does not get denied, that your first class denial actually gets adjudicated to pay. So that has been a huge value add for us when it comes to the denials and denials prevention.
Yeah, and you were mentioning it before, Ruby, like how much how much more challenging this becomes as you're acquiring group after group after group. Is it about being in a position to standardize that denial prevention and actioning through a technological solution that allows you to create that change that is so impactful? Or is it something else? Like I'm curious as to what that looks like. Maybe you can take our audience through like the life cycle of acquiring a group and how you think about intaking, right, that provider at any level to ultimately put them in a position to meet your standards.
So typically it had to be done manually before they go into our system. You have to start tracking their payer trending, right? It's like identifying positive and negative payer trends, whether it's payment trends, then you start looking at what exactly is coming back. Is it more coding? Is it more medical policy? Is it more front end issues? Is it um, uh, where exactly are they coming from, right? Are they missing modifiers? But again, they all fall under coding, right, for certain categories. And when you start to trend their patterns, that's when you start to build, um, in the system, some of these denial prevention strategies. And then once they come over, they would fall into a donus. Prior, we had to keep doing that constantly. It was no revenue intelligence at all, which made it much harder because now you're trending based off providers, different provider, different groups. They work differently, they document differently, they code differently. And although it may be some of the same services, it's their interpretation versus what they should be actually coding or billing or what should be happening at the front end. And having a platform to help navigate that, it created, I'll give you an example. Like there was, groups that were probably at 10%, 15%, 20%. They're down to like 4% denial rate. And part,
Wow.
yeah, between the two of being able to capture it a lot sooner. And then now we're able to trend it. And as we see them, we're able to go right in to the alerts that you guys submit, that you guys kind of show for us really quickly without us having to search for it, or from looking at the denial types in the denials dash that we have with you all. It's a lot faster. We're able to see, okay, this is what we need to do. We need to look into this group to figure out why is this happening so we don't let it happen again. So it's a lot easier to do target strategies as well if you're doing like code set denial targets, or if you're looking at payers and it's just random different codes, they're just doing whatever they want. And so it's a lot easier with revenue intelligence versus doing it prior to you guys coming on, which was a lot longer, more people, and manual processes.
Yeah, more forensic work,
Mm-hmm.
right? And certainly at the Cark and Rock, like it's you're trying to stitch
Yeah,
together the Cark and
right.
Rock to the denial,
You're
to
right.
the payer,
Mm-hmm.
to the
Mm-hmm.
provider, and
Yep.
ultimately trying to get to the root of the problem, right?
Yep.
And if I'm understanding correctly, the denials management, the alerting mechanisms help streamline a lot of
Right.
that investigation that then puts
Mm-hmm.
the team in a position of strength
Yep.
to then not only identify the root cause of that denial, but then to prevent it in the future.
Yes.
Correct?
Yep. And then with those action items, I call everything you guys give us actionable items, to be honest. And that's where I started earlier with having data that has no action behind it, or you can't do anything with it. We were able to create a lot of denial prevention strategies within our EMR system based a lot faster, based on what we're seeing right away. For example, when we had a payer issue where they weren't recognizing a location, we had to put millions and millions of dollars on hold. And once we started to see the trend very quickly, we were able to capture anything moving forward, right? So we caught it quick, came right in. Wait, what's going on? Looked into it. We saw, oh, this is a potential, $5 million problem. Let's get it now. And we got it. Then at that point, we were able to put hard stops on things to be able to make sure that it no longer happens a lot faster than waiting for a trend 30 days out, 45 days out. Now you're dealing with a ton of denials that could have been prevented, right? So that's where you guys have been really instrumental for us. So that's really a huge thing, because the last thing you want is to have millions and millions of dollars that you have to go in, resubmit, correct the claims, versus just, okay, I see the issue, let's stop it now. Let's wait until this issue is rectified with the payer, then we drop.
Tremendous to hear, Ruby. And I know that we have so much more to accomplish together and looking
Yes.
forward to what that future holds. But I think more tactically and strategically, our audience is really going to identify with the challenges that you've experienced and the leap of faith, the innovation, initiative and appetite that you and Allied Digestive Health have demonstrated is really inspiring. I'm curious, just to close out our conversation, any words of wisdom for fellow RCM leaders and professionals out there?
uh I here's what I can say. What I would My advice would be, invest in technology and automation, and look at the three components: people, process, technology. um it has helped this platform has helped in terms of even streamlining staff, making better decisions with people, and getting people to understand the data, and creating data for the tactical staff members that they understand, of which Adonis has been able to lay that out beautifully, which is very different than BI and some of the other things that we have. We have a lot of technology already, but the layers of staffing, they always can't use what would be good for me, wouldn't be good for them. So like, think about the audience, and in which when you're creating technology based platforms or utilizing intelligence such as Adonis, which they have that nail on the head. So my advice again is, invest in technology to automate and help assist with some of the manual processes.
Really well said, Ruby. And we can't thank you enough for spending time with us. We're excited again to continue to keep an eye on your progress, your career, all the
Yes,
great work that you're
yes.
doing at Allied Digestive Health. And
Thank
for
you.
anybody that's interested in connecting with you, is LinkedIn a good place to come find you?
Yes, absolutely.
Okay, excellent. We'll be sure
Mhm.
to put a link in the follow-up. If anybody else is interested in checking out more about Adonis or seeing more Revenue Innovation Series episodes, feel free to visit us at adonis.io. Until next time, take care.
Bye bye.